So this episode goes out for a friend of mine who's suffering from a fairly rare autoimmune diagnosis called Graves. I've been quite surprised with putting out these videos how many of my network are crawling out of the woodwork and telling me that they have some form of autoimmune diagnosis. So I'm really glad that these videos are connecting you to the idea that a reversal of symptoms is possible. And I'm showing you through the stories of all of my health coach friends and colleagues how they are going about putting their symptoms into reversal, into remission. And so this story with my colleague Lisa is really demonstrating that also it's not necessarily about the diagnosis. It's about these symptoms giving you a sign that there is imbalance in the body. And once you can start restoring balance by applying the functional medicine principles, changing your diet, changing your lifestyle, reducing the stress, getting deep sleep, and getting to the nitty-gritty of what else might be causing this imbalance in your body, then you can start to restore function and reverse these symptoms that you might be suffering from. It might not be easy, but it is possible. And that's why I'm sharing these stories. And some of them have managed fairly easily to reverse their symptoms, whereas some people like Lisa are still on their journey, but they have come a long way from where they were. So I hope you can take away a lot of nuggets from this particular interview. So enjoy the show. Thanks for watching. Hi, and welcome to Mind Shifters. I'm your host, Mireille Wagner, and today on the show we have a colleague of mine, Lisa Kamont. Lisa is a certified international integrative nutrition and functional medicine health coach. She empowers clients to find their healing environment in order to reverse chronic health issues. She has a deep passion for putting the puzzle pieces together of her clients' confusing health dynamics to get them on a path to healing and to feel like themselves again. That's great. And I love that you talk about puzzle piecing, Lisa.
Yes.
Welcome to the show. Great to have you on.
Thank you. Great to be here.
Good. So we have connected because we're both part of a mentorship. We've both studied at the School of Applied Functional Medicine and taking our studies further in functional medicine, working with a mentor quite closely and on case studies.
Yes.
So And I like that we're diving into the part about functional medicine being so much more about finding that balance. Do you want to give me your take on functional medicine and how you see it benefiting?
Sure. Yeah. I mean, I think when we talk about functional medicine, a lot of the times we're talking about getting to the root of the problem, getting to understand where there's imbalances in the body that we can resolve or that we can be empowered to work on resolving. I think for me, that notion of not being focused on a diagnosis, but really understanding more the functionality in the body, what might not be working optimally. Yeah. And how we influence that and balance those functions in the body to work more optimally. That's kind of how I see functional medicine. So it's less about the actual condition that somebody has going on, but more what is happening in the body or not happening to cause you to feel the way that you do.
Yeah, and I think the timing of us speaking about it is quite good because I've seen a lot of discussions in the functional medicine circles about functional medicine being done right and wrong. And there are kind of different approaches. And some functional medicine practitioners, as we know, are just throwing supplements in place of kind of medications. And they're not doing a very different approach to the conventional, just using more natural.
Sure.
Yeah, covering up kind of things. And whereas what we're learning is really to get at the core of where the imbalance is coming from and restoring the function, as you
said. Exactly. Yeah, not covering up, well, to use just a basic example, constipation with magnesium, but understanding why is it there in the first place. And that's powerful investigation.
Absolutely. Yeah. Well, so we're here because we really want to hear your story. And I'm so glad that I found you, because I have a friend, as I mentioned to you, that has Graves. And she said, please
Mhm.
tell me if you ever interview somebody who has Graves. And that's a diagnosis that you
Mhm.
were left with. Can you let us know how long ago that was, and what were the things leading up to that diagnosis?
Sure. Sure. Yeah, it was in 2016. And my youngest son was 3 at the time. And I bring him up because it was during that pregnancy that I identified a thyroid imbalance. But at that time, it was kind of low thyroid function.
Okay.
Um, and worked on optimizing that at the time so that I could become pregnant. But his birth was quite traumatic. And throughout that process of getting pregnant, we never looked at all of the thyroid antibodies. So I wasn't aware that I had thyroid stimulating immunoglobulin antibodies at the time. And so um, I think probably what led to that diagnosis is that trigger of the either the traumatic experience of his birth or other stressors in my life. And so when he was about 3, that's when the diagnosis of Graves came. And that's when we did see those antibodies were sky high. And I was feeling all of the things associated with hyperthyroid function. Um, Palpitations, rapid weight loss. I am 5'7" and I ended up weighing about 109 at one point. And so multiple trips to the bathroom a day, sometimes 10. And so it was very clear that that was the problem.
Mhm.
Um, and so I don't know for sure what led up to it, but my presumption is that there was that trigger just from pregnancy and, just the trauma of his birth and the stress associated with that, that kind of brought that swing to the hyper side.
So, if I understand correctly, you were suffering from hypothyroid, which is more on the Hashimoto's side, and we're treating for that, and weren't aware that you have been developing these other antibodies, which
Correct.
switch or swung you into the more hyperthyroid
That's
state.
right.
But
That's
so,
right.
how long was it before you actually realized, okay, this is Graves? Was it fairly quick because you had been working on the thyroid anyway? Or did it take a while
Oh,
to
I
realize?
wish I knew and could answer that really specifically, but I think it was just a progression and seeing those different symptoms come up that I wasn't used to. And then, the rapid weight loss, also my hair was thinning. And so finally, we looked at the antibodies with a more holistic doctor in my area, because by that time I had gone down that path as opposed to an allopathic route. And so she was the one that kind of brought up the fact we need to look at those antibodies. And that was very clear. They were very high.
Okay. So tell us a little bit about that, because you mentioned that you were doing the allopathic and then switched into the functional medicine route. Is this when you discovered functional medicine, or when was it that you discovered this other kind of approach?
Yeah, my story goes kind of before even the thyroid issues, because in my late 20s I had some other joint inflammation and was officially diagnosed with RA, but through working with a naturopath at that time, changing my lifestyle, changing my diet, I was able to eliminate those symptoms. And so I've kind of, in my mind, was, that was a win and I had overcome that. Um, and then it was not until later that we identified the thyroid component. And so my journey from the initial autoimmune diagnosis kind of brought me into a more holistic path. And so then I started looking at more whole food diets, sought out the care of a naturopath, and so then once you start exploring, you start seeing and learning about everything. And so then throughout that process is what brought me to functional medicine and really understanding the different opportunities there are there for testing, different body function and better understanding the patterns in my labs and really diving in to understand what was going on.
Yeah.
Did I answer the question?
Yeah, I think you did. But just to clarify, so you had been working in your 20s with a natural approach anyway. And RA is an autoimmune disease that maybe some people don't know. But, the functional medicine approach to all autoimmune we see as being relatively the same approach. Knowing what you know now, your approach back then, working with the naturopathic doctor, was it the same? And were you doing nutritional changes like you have been doing now for your graves?
Mhm.
Or have you done anything different now?
Oh, lots of different things now. Yeah, I mean, I think in hindsight is 2020. So if we were to go back, I would probably focus a lot more on gut healing at the time versus just removing foods. I would probably be more intentional about actually healing the gut at that time. And I don't know, maybe this would have not developed to the point that it has, or if conversely, I mean, we never know what was going to happen. I could have easily stayed on, it was recommended that I use methotrexate. And so that was kind of my um, pivotal moment where I said, I'm not going to do that. For me, that didn't make sense. And so um, I could have gone down that road. So we never know kind of what would have happened. But yeah, I mean, I think I would have focused more on the gut, and I would have really ensured there was a lot more dense nutrition coming in as opposed to just removing foods.
Okay. Okay. So you had still, over the time that you developed Graves, been gluten-free and dairy-free?
Hmm.
Okay.
Yeah.
And that's a great point to highlight, because
Hmm.
a lot of people think, okay, I've managed to get rid of my symptoms by taking out these foods,
Right.
um, and think that they can stop there.
Right.
And sometimes it's enough, but sometimes it's
Right.
not. Like you say, your situation is slightly different and you developed something else.
Hmm.
Um, so tell us where you're at now, because as far as I understand, you're still on your journey and you're discovering lots of things still
Yes.
about what's going on. Tell us about that.
Sure. Yeah. Well, with the graves, I actually made quite a bit of progress because I started researching and understanding the connection of dental health as it relates to autoimmunity. I mean, and as you know, there's often a toxic burden on the body when it comes to autoimmunity. And so through the help of my own coach, we were looking back at some labs, and it just looked like there could still be some type of infectious dynamic. And I actually identified a cavitation in my body. And so I had that removed last year. And then the year prior to that, I had my amalgams removed. And so I bring those two events up because before and after that is when my antibodies dramatically shifted. And so I don't know for listeners if they're looking at like a reference range for thyroid stimulating antibodies, it is between 0 and 0.55. And mine were 12 for
Oh,
a period of time. So that was really bad.
yeah.
That was probably when I was my worst. And so then after those dental events, I was able, right now there are 4. And so the antibodies are still high, but through taking kind of those burdens off of my body with the infection in my mouth and with the toxic burden of mercury in my mouth, those really showed in the reduction of antibodies and in my symptoms. So I was originally on like 5 milligrams of antithyroid medication a day, which is the methimazole. And now I only take 2.5 milligrams per week. And so, yes, I'm still on the journey and I'm still working, but I'm no longer in a place where I need to take antithyroid medication every day. So I'm getting to be able to better manage that just with kind of stress management and diet alone.
Yeah, titrating down. Yeah, that's great that you point that out, because I think a lot of people are not thinking as well about dental work and how
Mm-hmm.
that can be have such a huge impact on the whole microbiome.
Definitely.
But you've also mentioned in our chats that you've discovered something else that could be at play at what's causing you to have kind of a delayed recovery.
Mm-hmm. Yeah. I mean, through everything I've done and through the work that I've seen move the thyroid antibodies, I know that the things that I've done have helped, but yet I was kind of at a plateau. And so I couldn't figure out why, both with my thyroid and some other kind of chronic pain issues that I have.
Mhm.
And so I did end up testing for Lyme disease. And so there are some Lyme related infections. And co-infections that are part of my picture that of course wouldn't be everybody's picture with Graves, but I guess what this shows me is that there's just more work to be done.
And to, yeah.
um,
And it's
and
good that you
so
found them, because I mean, you realized that there was still something there, and
mhm,
that's that process of discovery. Is that, should we remove the foods? Maybe we remove some dental toxins. But if it's not getting you the full way there, what else is there that could be
Right.
causing your body a disturbance. And so you kept looking and found Lyme. So can you explain to the people listening that aren't familiar with Lyme, what are the kind of symptoms that one experiences with typical
Mhm.
Lyme?
Yeah, and I mean, I think it's probably different for a lot of people, and the severities of what people experience are very different. For me, I've had this chronic wrist pain for like 10 years, and everything I've done just hasn't seemed to move the needle at all. And I mean, like dry needling, chiropractic, stem cells, PRP, all of the things,
Wow.
and just nothing changes it. Um,
And that's completely separate.
even,
Sorry for interrupting. That's
no, it's
completely
okay.
separate from RA. I mean, the joint pain that you're experiencing, it's not feeling like the RA joint pain that you had, and your CRP.
That's correct. That's correct. Yeah. My joint swelling that I had previously is no longer there.
Okay.
And lab markers that reflect RA are no longer clinically high. And so what I'm left with is not, in my opinion, is not related to arthritis. I'm sure that there could be some damage associated with it. And so that's the question, how much can I influence now? How much mobility can I regain
Mhm.
by removing the infections from my body related to Lyme? So that is the current part of my journey, and there's a lot to learn. So for me, it's wrist pain. I think a lot of people, it can be extremely debilitating, depending on how advanced and whose body we're talking about.
Yeah, yeah, perfect. Now, I think for a lot of people listening, they hear this rather rare diagnosis, and then all these kind of complications that you've been going through. And so for a lot of people, that could be totally overwhelming, which is understandable.
Sure.
How would you, as the functional medicine practitioner, simplify that for them so that it doesn't become overwhelming? What are the
Hmm.
kind of steps that you would recommend to them so that they can
Yeah.
get started?
Yeah. Well, and it was overwhelming for me.
Yeah.
And it still can be, I think one of the things that we learned, I know, in SAFM is about kind of the fact that any disease state or any lack of ease in the body is really only going to be associated with 5 things. And that's infection, allergens, trauma, stress, and toxins.
Mhm.
And so I think it helps me to kind of understand that there's only those 5 buckets that you could fall in. And so investigating each of those 5 buckets and figuring out where there's opportunities for healing within those areas can be helpful.
Yeah.
If you don't, I have food sensitivities, but I don't have a lot of allergens. And so that's
Mhm.
not a big player in my picture. Obviously, infections is a big picture in my player. So I work in a big player in my picture. So I work there. For a lot of what I'm doing. And so I think from a mindset point of view, it's helpful to kind of categorize the areas that you can work in. And
Mhm.
then, it is easier if you have somebody to walk the path with you. I mean, as much as we've learned and as much information is out there, it has been just so helpful to have my own coach to just kind of make sure that the path I'm going on is one that makes sense, because the amount of information, especially when you're talking about autoimmunity and Lyme and all these different things, it's overwhelming and you're not sure. I think a lot of the overwhelm comes with fear that you don't know if you're doing the right things. And
Mhm.
so having somebody to kind of walk alongside you, that even if they're just another set of eyes and also just a guide to help show you what some powerful steps could be.
Yeah, yeah. I think those are some great recommendations for
Mhm.
people. So, what would you say as one closing thought to anybody that might be suffering from Graves? Um, do you have any particular advice for them?
Um, I mean, if they already know they have Graves, they likely already know that they have higher antibodies. And so I guess my advice would be to try to do the work to figure out what the triggers might be.
Mhm.
There's a doctor local to Charlotte named Dr. Eric Osansky, and he has put out a book on this topic that's really helpful and just kind of helps walk through all of the different areas to look at and research that somebody might be interested in reviewing to see if they've done those things.
Yeah.
Um, Definitely working on healing the gut. There's so much there. If we can't absorb and digest the nutrition that we're taking in, then nothing's going to work right, including our thyroid. And so making sure that you yourself or with a practitioner are working on gut health, I think, is really key.
Mhm.
And those are kind of the main things I would say. I think. And if you don't know you have Graves from an antibody test, but you think you do because of different symptoms around anxiety or hair loss or weight loss, heart palpitations, then definitely get those antibodies checked, because in hindsight, if I would have done that earlier, I sure would have had a better picture of what was going on.
Yeah, yeah, that's true. And
Mhm.
you might have been able to avert a diagnosis,
Sure,
possibly.
sure.
Yeah, yeah, yeah. Great stuff. Thank you so much. And it was wonderful to have you on the show. Is there any way that people can reach you? Do you have a website or email that you want to
Sure.
mention?
Yeah, sure. I have a practice. It's called Inspiring Health NC, and my email is just mail@Inspiring Health NC. And so, sure, if anybody wants to reach out, ask a question, or learn more, I'm
Yeah,
happy to.
perfect. Well,
Yeah.
thanks so much for your time. It was
You're
great.
welcome.
All right.
Thanks.
Bye-bye.